I'm Dr Tessa Gargett and I am the 2023 Florey Research Fellow. So I work in translating research into early phase clinical trials at the Cancer Clinical Trials Unit at the RA. So we're particularly interested in immune-based therapies. So these are quite different from traditional therapies that might use chemotherapy drugs or surgery. What we're looking to do is really boost the immune response to a patient's tumour. So hopefully the immune system can attack and kill the cancerous cells and control the tumour growth in that way. We're looking for patient groups that don't have a lot of treatment options. So particularly those patients that have tumours that are very aggressive, very rare, and primary brain tumours are a classic example of this. They have really poor outcomes for the patients. And the patients only have the sort of standard therapy option. They get some surgery, some chemo, and some radiotherapy, and there's no second line, like there's nowhere to go to after that tumour inevitably regrows. We're using a patient's own white blood cells. So if a patient comes to us with their cancer, we take a blood collection. From that, we get out the white blood cells, and these are the cells that really make up your immune system. And we do a little bit of tweaking in the lab, so we grow them up into larger numbers. We do some genetic engineering to try and teach those white blood cells to recognise the patient's own cancer. So when they get a reinfusion, the treatment that they're getting is their own cells put back into their blood that hopefully can track down and kill the cancer cells. So the research we're doing now, we hope it'll benefit the patients that are on our trials, but really what it's doing is teaching us about whether this therapy works and in what situation, so that in the future we hope we can treat patients better, and then those patients, after they've had their standard treatment, now have another option. So that tumours come back and suddenly we have something new we can offer them that should at very least control the growth of their tumour, get them more time, but ideally completely destroy the tumour and give them many more years of life. These clinical trials that I'm talking about are the first of their kind in Australia. And actually in the kind of combination treatment we're giving, they'll be the first of their kind in the world. We've made some decisions about the protocol and what combination therapy the patients will receive. That means that they'll be getting a world first treatment that we've developed here in Adelaide.